Welcome, and thank you for joining us today. Our presentation today is an overview for outpatient dialysis services for the Federal Emergency Services Program. The topics covered in this presentation are dialysis case creation and monthly certification forms, extended service authorizations for dialysis services, claim submission and billing requirements. Questions about this presentation can be submitted via email to providertraining@fes@azaccess.gov. So let's get started. Dialysis services for FES members. Access will reimburse outpatient dialysis services only for FES members that are diagnosed with End Stage Renal Disease, or ESRD. Outpatient dialysis services are covered as an emergency service when the member's physician, nurse practitioner, or physician assistant signs a monthly certification stating that the member requires dialysis services at least 3 times a week. Now let's go over the federal definition of emergency services. The same rule applies to outpatient dialysis services as any other service provided under the FES program, and that is all services must meet the federal definition of an emergency medical or behavioral health condition. The federal definition states an emergency medical or behavioral health condition means a medical condition which includes labor and delivery, or a behavioral health condition manifesting itself by acute symptoms of sufficient severity, including extreme pain, such that the absence of immediate medical attention could reasonably be expected to result in one of the following: placing the member's health in serious jeopardy, serious impairment of bodily functions, serious dysfunction of any bodily organ or part, and serious physical harm to self or another person for a behavioral health condition. Now let's move on to the Access dialysis certification forms. Access requires 2 forms to verify medical necessity for the services to be completed, signed by the treating physician and submitted to Access Administration for review. The initial dialysis case creation form and the monthly certification of emergency medical conditions. The monthly certification form must be completed as it states on a monthly basis. So why are these forms required for dialysis services? The initial dialysis case creation and monthly certification forms are used to certify that in the treating physician's opinion, in the absence of receiving dialysis treatment at least 3 times per week, would reasonably be expected to result in any one of the following. So again, we have placing the member's health in serious jeopardy, serious impairment of a bodily function, or serious dysfunction of a bodily organ or part. Now let's talk about the authorization process for outpatient dialysis services for FES members. Access guideline states that a prior auth is not required for emergency services for FES members. However, there is an exception, and that is for outpatient dialysis services. An extended service authorization is mandatory for an FES member who is receiving outpatient dialysis services for a provider to be reimbursed for services. An extended service authorization is not the same as a prior authorization, but serves the same purpose. The extended service authorization is mandatory and will be issued by the Access Utilization Management Team upon approval. The extended services authorization serves as an approval for outpatient dialysis services for FES members to include the length or duration of those services. Now let's move on to billing for dialysis services. Access reimburses registered freestanding dialysis facilities under an all-inclusive composite rate, which covers non-physician services, supplies, diagnostic testing, and drugs. Freestanding renal dialysis facilities must bill all of the charges for 1 month on one UB04 claim form. Split billing these dates of services is not allowed and the claims will be denied. As with all payers, there are certain claim billing requirements that must be met. For more detailed guidance, billers and coders can review the Access Fee-for-Service Provider Billing Manual, Chapter 15 for dialysis services. So let's do a knowledge recap. The Access initial case creation and monthly certification forms must be completed by the attending physician and submitted to Access. An extended service authorization is mandatory. Dialysis claims must be submitted on a monthly basis only. Split billing dialysis services is not allowed. Billers and CODIS should adhere to access billing requirements for outpatient dialysis services. Medical documentation and itemized statements should be provided for review. Outpatient dialysis services are subject to medical as well as post-payment review. This concludes the presentation for dialysis services for members that are enrolled in the FES program. To view additional information, providers can refer to the Access Fee-for-Services Provider Billing and Policy Manuals by clicking on the links below. Thank you.